Before I dive into today's topic, I need you to stick with me all the way to the end. Because point number 3 I'm going to share is, in my opinion as a physician, the quietest, most overlooked, and most dangerous one of all. A lot of people watching right now are probably already living in that third scenario without realizing it, so don't click away. What's coming could genuinely change the direction of your health for the rest of your life. Welcome back to Body Reset After 50. I'm Dr. Devid Volds, and on this channel we talk about the things conventional medicine often skips. The full truth about how your body really works after 50, backed by solid science, no fluff, and no hidden agendas pushing creams or miracle pills. If you're new here, hit that subscribe button and turn on notifications. We don't sell supplements. We teach you how to listen to the signals your body is already sending you. Today, we're tackling something that affects hundreds of millions of people worldwide, and most are handling it the wrong way. We're talking about those yellow, thick, cloudy, or deformed toenails that just won't clear up no matter how many creams, polishes, or home remedies you try. And the very first thing I want you to understand is this. In many cases, that nail problem isn't just a surface fungus. It's your body waving a red flag from the inside out. If you've been ignoring it for months or years, the stakes are a lot higher than you think. Let me start with something that happens far more often than most people realize. Take a typical 65 or 70-year-old who's been battling thick yellow toenails for years. They've tried every antifungal polish from the pharmacy, vinegar soaks, baking soda, you name it. Nothing gives lasting results. The moment they stop, it comes right back. Then one day, during a checkup for something else, the doctor notices a small wound on the toe that isn't healing properly, poor circulation in the feet, and some concerning blood work no one had connected to the nails. What looked like a minor cosmetic issue turned out to be the visible sign of a much deeper systemic problem that had been quietly progressing for years. This story, in different forms, plays out in clinics every single day. And today, we're going to break down exactly why. First, let's be clear. Onychomycosis, the medical term for fungal nail infection, is very real. Dermatophytes, Candida species, and non-dermatophyte molds can absolutely infect the nail and cause that familiar yellow, thickened, brittle look. This is well documented in medical literature. Overall, it affects about 4% of the general population, but the rate jumps sharply with age. In people over 60, it can exceed 20%. That means 1 in 5 older adults deals with this. So it's common, it's not embarrassing, and it's definitely not just about poor hygiene. Anyone can get it, especially as the years add up. Major medical centers specifically warn people with diabetes to avoid aggressive home treatments and seek professional care instead. Mistake number 3, the most dangerous one. Ignoring the systemic warning signs the nails are showing. The big toenail is the farthest point from your heart in the entire body. Blood has to travel the longest distance to reach it. When that tissue stays damaged for years, when fungus keeps winning despite treatment, when surrounding skin loses elasticity and the nail keeps thickening, you have to ask, how good is the blood flow getting all the way down there? How strong is the immune response that should be fighting this? What's happening inside the body that's letting this continue month after month? Ignoring these questions is what can turn a cosmetic problem into a medical emergency. The data is sobering. Onychomycosis in people with diabetes is linked to much higher risks of serious foot complications, including ulcers, secondary infections, and, in advanced cases, amputations. About 25% of people with diabetes will develop a foot ulcer in their lifetime, and 14–24% of those will need some form of amputation. Neuropathy is present in the vast majority of those ulcer cases. These aren't just numbers, they're real people who once had a warning sign they didn't recognize in time. So if you've made it this far and you're thinking, okay, Dr. Volds, what should I actually do? That's exactly where we're headed, because this channel isn't here to scare you. It's here to arm you with real, evidence-based tools so you can make smarter decisions about your health. Here's the action plan. 1. Get a proper medical evaluation. If your toenails are yellow, thick, or deformed and nothing has worked, don't just ask for another nail polish prescription. Ask for a full workup. Request a check of circulation in your feet, an A1C test, which shows average blood sugar over the past 2 to 3 months, the gold standard for spotting diabetes or prediabetes, and a complete metabolic panel. If you have risk factors like extra weight, inactivity, high blood pressure, family history of diabetes, or you're over 45, these tests are priority. 2. If you already have diabetes, foot care is not optional. It's a top medical priority. Current guidelines recommend a full foot exam at least once a year and a quick visual check at every routine visit. This includes testing sensation with a monofilament, checking pulses, looking at nails and skin, and catching any early changes. Tight blood sugar control is one of the most powerful ways to slow or prevent neuropathy progression. Proper patient education on foot care has been shown to cut ulcer and amputation rates by as much as 50%. That's a massive win, and it starts with the right information. 3. If you don't have a diabetes diagnosis but you have risk factors and stubborn nails, or occasional tingling, numbness, slow healing cuts, or very dry cracked heels, don't wait. These can be early signs of neuropathy or circulation issues that deserve prompt attention. Remember, up to half of people with diabetic neuropathy have no clear symptoms. No strong pain doesn't mean everything is fine. On the treatment side, for moderate to severe onychomycosis, the most effective option is usually an oral antifungal like terbinafine or itraconazole, the first-line choices in clinical guidelines. These work from the inside, traveling through your bloodstream to reach the nail matrix where the fungus grows. Studies in people with diabetes have shown mycological cure rates up to around 70–80% with terbinafine over 12 weeks. They need to be prescribed and monitored by a doctor, especially liver function tests in some cases, but they attack the problem at its source, not just the surface. Modern topicals, like efinaconazole or cyclopyrox, can help in milder cases or as add-ons, but their success still depends heavily on fixing any underlying metabolic or circulatory issues. The best approach is always two-pronged. Treat the fungus and correct the conditions that invited it in the first place. Daily foot hygiene matters too, but the smart kind. Dry thoroughly between the toes after every shower. Fungus loves moisture and warmth. Wear breathable socks and rotate shoes. Cut nails straight across with clean tools. If you have diabetes or circulation concerns, let a podiatrist handle nail care to avoid accidental micro-injuries. Regular movement is powerful medicine here. Walking 20–30 minutes a day, simple ankle mobility exercises, and elevating your legs occasionally all improve venous return and peripheral circulation while helping with blood sugar control. Better blood flow. A less friendly environment for fungus and stronger local immunity. Nutrition plays a supporting role by keeping blood sugar stable. Cutting back on added sugars, refined carbs, and sugary drinks helps shift the internal environment the fungus needs to thrive, but always as part of an overall plan with your doctor, not as a replacement for proper treatment. One last important point before we wrap up. The shame many people feel about their feet is real. They skip the beach, hide their toes, avoid showing them to doctors. But that shame has a direct medical cost. It delays care and leads to more home experiments. There is nothing shameful about your feet. They're simply speaking the only language your body has: physical symptoms. That language deserves to be heard, understood, and answered with smart medical care, not covered up. Quick recap of what matters most. Yellow, thick, deformed toenails are often real fungal onychomycosis, and it is treatable with the right medicine. When it's chronic and stubborn, it's frequently a warning sign of deeper issues like diabetes, prediabetes, or poor circulation that need investigation. Peripheral neuropathy affects nearly half of people with diabetes and can be silent. Untreated, it raises the risk of serious foot ulcers and amputations. Aggressive home remedies can backfire badly. The winning strategy: oral antifungals when appropriate, plus control of underlying conditions, plus proper foot care and prevention. Early detection and education can slash complication rates dramatically. If this video helped you connect dots you hadn't seen before, drop a comment below and tell me your experience or ask a question. Your story might help someone else who's reading. Share this with anyone over 50 who's been fighting nail issues without real answers. It could be the information they've been missing. If you're not subscribed yet, do it now. We'll keep delivering honest, science-based guidance to help you reset your body and stay strong after 50. Take care of those feet. They've carried you this far. See you in the next video. But here's the game-changing question. Why did the fungus arrive, settle in, and refuse to leave? That's what most people, and unfortunately many doctors, aren't asking properly. Fungi don't thrive in healthy tissue with good blood flow and a strong immune response. For a chronic nail infection to take hold and resist treatment after treatment, it needs a welcoming environment. And that environment almost always ties back to one or more of these three underlying issues: poor peripheral circulation, unstable blood sugar control, or broader metabolic changes that weaken your local immune defenses. This isn't guesswork. It's supported by strong peer-reviewed studies. Research shows that people with diabetes are roughly 3 times more likely to develop onychomycosis than those without it. And it's no coincidence. Long-term high blood sugar creates multiple conditions that feed fungal growth. It impairs white blood cells' ability to fight infection, causes peripheral neuropathy that dulls feeling in the feet so small injuries go unnoticed, promotes peripheral artery disease that reduces blood delivery to the extremities, and slows wound healing so tiny breaks stay open. Put all that together and the toe becomes the most vulnerable spot in the body. And the fungus knows it. Now here's a statistic I need you to hear clearly because it's one of the most critical in this whole video. Diabetic peripheral neuropathy, nerve damage from elevated blood sugar, affects nearly 50% of adults with diabetes over their lifetime. Half of them. Even more alarming, up to 50% of people who already have this neuropathy have no obvious symptoms at diagnosis. They're walking around, sleeping, living normally, while their nerves are being damaged in silence, circulation in the feet is declining, and the perfect environment for fungus is being built day by day without them knowing. That means some of you watching right now may have undiagnosed diabetes or advanced prediabetes with neuropathy already underway, and the only visible clue is those stubborn toenails. Do you see why I said at the beginning that the third point is the quietest and most dangerous? The lack of pain doesn't mean there's no problem. Sometimes it means the exact opposite. Let's talk straight about the 3 major mistakes millions of people make with this issue, because recognizing them is the first step out of the endless cycle. Mistake number 1. Treating only the surface without looking for the root cause. When you slap on a topical antifungal polish, you're only hitting the tip of the iceberg. These treatments have limited ability to penetrate a thickened nail plate. Cure rates with topicals alone are often low, especially in moderate or severe cases. But even worse, if there's an underlying issue like uncontrolled blood sugar, poor circulation, or a weakened immune response, the fungus has everything it needs to survive and come back. It's like mopping the floor while the faucet is still running full blast. You can do it for years and never win. Mistake number 2, relying on aggressive home remedies, especially if you're over 50 or have other health conditions. Vinegar, concentrated hydrogen peroxide, diluted bleach, cutting nails with unsterilized tools, or applying strong acids. These are common but risky. In someone with neuropathy, you might not even feel the micro-injuries you're creating. In someone with poor circulation, those tiny wounds heal slowly or not at all. What starts as a DIY attempt to kill the fungus can open the door to dangerous bacterial infections that can lead to cellulitis, bone infections, or diabetic foot ulcers.